Bismillahirrahmanirrahim. My name is Dr. Abbas Sachedina. I am a urologist by profession, dealing with the diseases which involve the urinary system. Today, inshallah, we will be having a short talk on a condition which is becoming quite prevalent, not just worldwide but also in our community. We will be discussing a few issues on the topic of bladder cancer. So, bladder cancer, by definition, involves the abnormal cells which grow in the lining of the, specifically, we are discussing about the urinary bladder. So, in terms of the cells lining the urinary bladder, in terms of when we discuss urinary bladder cancer, this involves basically on the different invasion levels of these cancer cells. So that is whereby we will eventually get the staging of the disease. Speaking of invasion of the cells, of the cancer cells into the urinary bladder, we as urologists usually divide this disease in terms of whether it is muscle invasive or non-muscle invasive. Basically, this is what guides us in terms of the treatment and our management plans. Further discussing in terms of the microscopic characteristics of these cancer cells, we usually have what we call it as the transitional cell carcinoma and the squamous cell carcinoma. Well, basically, this is just for general knowledge, but in terms of our specialty, this is what helps us differentiating the type of the urinary bladder cancer and the further treatment plans. When we come to the risk factor, this is, I would say, one of the reasons why I chose to do this topic is because of the prevalence of this risk factor within our community. So basically, the two risk factors which account mostly in this disease are exposure to tobacco, that is mostly we are discussing in terms of tobacco smoking, and occupation, which account for these two most frequent routes of environmental exposure. When it comes to tobacco exposure, the most common exposure which we are dealing with is in terms of smoking. That is the one which is basically most related to bladder cancers. However, other forms of tobacco have also shown to have a moderate risk. So when we come to other risk factors, genetics may play a role when combined with other behaviors such as the tobacco smoking, but also in terms of the hereditary factors, it does have a low risk in terms of the hereditary factors. When we come to the occupation, different occupations have been shown to increase the risk of developing bladder cancer. These involve working in tobacco industries, working with dyes, those who work in the rubber industries, those who work with paints, also those who work in the leather industry. Together with some risk is shown also in those workers in the petroleum industry. Other risk factors which may increase the risk of developing bladder cancers may involve chronic bladder inflammations, which may involve in those patients who have a chronic indwelling urethral catheters. Also, in terms of our African population and where we live, we mostly come in contact with this disease, which is commonly known as bilharzia, also in other terms known as schistosomiasis. It is also a big risk factor, which is the one which is causing the most bladder cancers in this part of the world. However, those patients who have undergone prior cancer treatments, such as those who are undergoing radiotherapy, especially which are being directed towards the pelvic region, some form of risk when it comes to developing bladder cancer. Lastly, also environmental exposures such as poisoning, specifically speaking, arsenic poisoning. So, coming into the signs and symptoms of this disease, most of the patients may present or do present with blood in urine. However, what we need to realize is that blood in urine is not always that which is visible to the eye. And hence, we have two types of blood in urine. Basically, we term it as the microscopic and macroscopic hematuria or blood in urine, whereby the microscopic is basically through we come to know about it through a urine test, whereas the macroscopic is that which is visible to the naked eye. Also, patients may present with other lower urinary tract symptoms such as frequent urination, pain and burning sensation in urine. But also, we have come to realize that most of the patients who do end up being diagnosed with bladder cancers, also along the way, they have been treated for recurrent UTIs. So patients go to the hospitals, they get antibiotics being told that it is a UTI, and they go on being treated for UTI on a recurrent basis. And that is also in terms of one of the challenges we have come across. How we diagnose this disease is through different tests, whereby we have different tests for testing the urine, but also a simple ultrasound may also be helpful. However, of higher value in which we do use to most of our patients, we may require to do a CT scan. When we come to the management of this disease, usually the management depends on the findings and the stages of the disease. So in terms of the staging, the first requirement, we may require an endoscopic test of the patient, whereby we do something what we call it as a urethrocystoscopy, whereby we will view the urethra together with the urinary bladder, and whereby if we find a suspicious lesion, we may need to take biopsy. So all in all, this is just an overview to this topic, and the reason why we have decided to speak about it is that it is becoming more prevalent in our community. Furthermore, in terms of the epidemiology, men have shown to develop this disease more frequently than women, and also current data suggest that yearly almost 500,000 people are diagnosed with this disease. Hence, the take-home message to all our community members is that we need to be more careful with our behaviors, and especially to our youngsters, it is a message that smoking is harmful, and we should be avoiding such harmful behaviors.